Hi, my name's Victoria. I work for the PHN and I'm currently the COVID-19 Education Officer, and I'd like to welcome you tonight to the Western PHN Capacity Tracker supporting the management of emergencies in residential aged care facilities. I'll be presenting, but also online is Tabitha Jones, who is the COVID-19 Project Response Coordinator, so she may tune in and help out during this presentation. So welcome. Before I start, I'd like the acknowledgement of country. I'd like to start this evening's meeting by acknowledging the people of the Wiradjuri Nation and the different nations on which people here sit this evening. I'd like to acknowledge that we work on the traditional lands of many Aboriginal clans and nations and pay respect to the elders past, present and emerging, and acknowledge their continuing connection to the land, water and culture, and for the contribution to help shape the life of the communities in which we all work and live. We are committed to working in the spirit of partnership and collaboration with our region's Aboriginal communities and peoples to improve their health, emotional and social wellbeing. I welcome Aboriginal and Torres Strait Islander Australians who are present in this meeting. Before we go on, just some pleasantries. If you'd like to type your full name in the chat box in the control panel so that we know who has attended for certificates this evening. If you could mute yourself if you're not speaking and this stops any feedback and noise. You can share your webcams to create more of a conversational interface so we can see who, you can all see my face so I can see yours. If you have a question, I'm more than happy for you to unmute yourself and type questions into the chat box on the side. There will be time for questions at the end of tonight's presentation. Okay, Capacity Tracker. What is Capacity Tracker? Well, it's a program that was developed by the NHS in the UK to minimise the delay in transfer of care of patients assessing aged care. In the UK, it was set up to be something very different to how we're actually using it now within Australia. In the UK, it was set up to look at vacant beds and where vacancies were around the NHS, which their hospital settings. However, in 2020, this year at the beginning, Hunter New England, Central Coast and PHN, as an emergency management system, adapted and implemented Capacity Tracker to what we know it as today. So, oops, can I just get everyone to go on mute? Sorry, bro, can I just get you to go on mute because there's a lot of back noise happening. Thank you. So Capacity Tracker is an award-winning online tool where RACFs and GPs and AMSs services can provide real-time data to help Western PHN easily identify issues that may be occurring and provide improved support. The Western PHN is currently funding the rollout for a 12-month trial period to all RACFs and GPs in Western and Far Western New South Wales starting in December 2020. We're very excited about it. I can let you know that I am not IT savvy at all, which you may have realised tonight, and Liz and Oliver have helped me out. But I've actually played with Capacity Tracker and it is really user-friendly. Why are we implementing this system? This system, we believe, is a key opportunity for Western PHN to better understand the needs and challenges of the primary healthcare organisations in our region and identify how best we can support them. Western PHN has a role to play in supporting and linking primary care organisations and providers. I actually am going to PHN and I thought that the GPs and the residential aged care facilities were linked and that the pharmacies would be linked as well, but no one is linked, which I was quite amazed at. So I really endorse this. I'm a pharmacist as a background and I really endorse that Capacity Tracker will allow us to continue the best support our community can get. we will be able to assist directly where we can, or we can provide links to other bodies or other connections who will be able to provide support to that organisation. So Capacity Tracker can play a key role in emergency situations such as what we've seen this year in COVID-19 pandemic. In New South Wales, we are very lucky and we have not had the COVID-19 pandemic like what has hit Victoria and the nursing homes in Victoria. Other key emergency situations which has hit New South Wales this year is bushfires, where I am aware that nursing homes had to evacuate. And if we had the PHN had then Capacity Tracker up and running for Western New South Wales, we would have been able to help people transfer residents to other RACFs that would have been able to help within that situation, as well as natural disasters such as floods. Now, New South Wales, we are hit by bushfires and floods on a regular basis, and COVID-19 is here to stay. It's not going away, and another role that Capacity Tracker will be able to play in the future is with immunisation. It can also play a really strong part in better understanding primary care organisations in times of less urgency, like what we have at the moment. We don't have any bushfires. COVID-19 is not happening in New South Wales, thank goodness, Western New South Wales or Far West at the moment. So this is a really good time to implement Capacity Tracker and to get a much better understanding between the relationship between our GPs and our residential aged care facilities, and down the track as we further roll this out, also with immunisation as well as community pharmacies. What I'm going to show now is a short video on how initially to register your facility on Capacity Tracker. I apologise, it's got really dagging music. I didn't make this YouTube video, but it does show how simple it is. And I have watched this in a way to teach myself, to teach you guys. So I thought, why not a better way to share this video with you? Enjoy. It does go for 9 minutes, but it is definitely worth it. And as again, the music's daggy, I can't change that.
This short support video will explain how residential aged care facilities can register for the Capacity Tracker. Once you've opened an internet browser, enter https://au.capacitytracker.com and press enter. To start the registration process, select the large green button Register Now. Enter your email address. This will be required each time you log into the Capacity Tracker, and will also be the email address that receives the new user login details and temporary password. The email address needs to be one that hasn't previously been registered with Capacity Tracker. If you do enter one that has already been registered, you'll be warned that the username has already been taken. Generic email addresses can be used here for teams who want to log in with the same account for ease of use. It doesn't matter whether organisations use their own staff emails or a generic email. Just remember, the login details will be sent to that registered email address. Enter your full name. Please note this would be a team name if you opted to create a generic account. Enter the best contact number for this email address. It can be a mobile or landline number and needs to be between 8 and 12 digits. Enter your job title. If you've selected a generic email account above, you might want to repeat the name of the team that you entered in the full name field. Now select the user type. An approver can grant new users access to your organisation in the Capacity Tracker by approving them, or remove existing users if they've left. There should always be at least 2 approvers for each organisation to cover annual leave, sickness and other absences. This would normally include the manager and deputy manager, but you're welcome to have as many approvers for your organisation as necessary. The standard user, as well as approvers, can update bed availability, business continuity information, and the organisation setup. There are no limits as to how many standard users you can have for your organisation. The provider type should also be selected. In this case, residential aged care facility should be chosen. Now press Next. Enter the postcode of your care facility. You'll then see a list of organisations to choose from. To select your organisation, find it in the list and click to select. You're able to choose more than one organisation if required at the same or at another postcode. Just make sure you have the postcode available for each organisation you want to register with. Now press Next. The final part of the registration process simply involves clicking to agree to the terms of use and whether you consent to receive important email communications. Pressing Complete will trigger an email to Capacity Tracker System Administrators and any approvers already registered with your organisation. Once your application has been approved, you'll be sent an email with a temporary password. This will normally be within 24 hours, but will depend on how quickly your organisation's approvers review your registration. Once you've received your temporary password, please try to log in. The first time you log into Capacity Tracker, you'll be asked to update your password to something that's more memorable. Here's a tip. When logging in, put a tick in the Remember Me checkbox below your password. That way you won't have to keep typing your login details every time you use the Capacity Tracker. When you log into the Capacity Tracker, you'll be presented with a screen showing several tiles. Select Residential Aged Care Facilities to display your organisation on the next page. You'll see a blue link in each of the 4 columns of the table. We're going to quickly work through each of the links and show you what you need to do. Please note, if you've registered for multiple organisations, all will be listed, and you'll be required to repeat the following process for each one individually. Most of these steps need only be done once to ensure your organisation is correctly set up. The only information that needs to be changed routinely are in the Business Continuity and Vacancies sections. The first link you click on is Edit, after the organisation name. You can see the links from the previous page have now appeared at the top of this page, and all you need to do is work your way across them in order. Check the name and address details for your organisation and update as required. Classification information for your organisation is pre-populated in the system. This has been provided by your primary health network and is only editable by an administrator. The miscellaneous details have been imported from information provided by the primary health network and enables other users of the Capacity Tracker.
Oops, sorry. Sorry, everyone.
To quickly link to these places on the internet. Please ensure the Manager's Details section is fully completed and always kept up to date. The details in this section are used throughout the Capacity Tracker and in particular are used in the main search results to help other users make contact directly with your organisation should they want to reserve one of your vacancies. The Extended Room Details section allows you to set the ensuite facilities and equipment detail and also define new areas for accessibility if needed. You can see which users have access to the organisation, and then you're presented with the Save Details and Cancel buttons. Please remember to click Save Details if you've made any changes you wish to keep. The note log is not mandatory and is effectively a notice board for the manager to use to publicise anything they feel is relevant to the other users of the Capacity Tracker. Each organisation has control over whether it uses the note log and what's entered. Some use this facility to promote certain features, others use it to advise of any particular restrictions in place. The choice is yours, and you can add as many notes as you like. These notes appear in user search results, so please be careful what you type. Back to the top of the page and select Business Continuity. This should be completed as agreed with your primary health network. Here you can set your current status covering your admission status, overall status, COVID-19 resident and staff count, and it also shows when it was last updated and by whom. You can also update your workforce status covering RN, EN, care and other workers, stating how many are employed and how many are absent. You can also set your staffing status, hovering over the status for prompts. Within this section, you can also set your availability of PPE status, as well as adding any GP practices that are linked to your organisation. Press Save Details if you've made any changes. There is also a contact directory here. However, this is optional, like the note log. Now move on to the Edit Services section. Here you can specify which services you offer for both short stay services and long-term vacancy types. Simply click the relevant checkboxes and you'll see them turn green. To deselect any green ones, just click again. It's important to note that the long stay services you select on this page will determine what you see in the next sections. Press Save Services if you've made any changes. Now move to the Edit Total Capacity section. For each vacancy type you offer, state how many you could offer if your site was empty. In other words, the total number of beds you have. It's worth noting that this information has been pre-populated with information provided by your primary health network. Press Save if you've made any changes. Now move to the final section, Edit Vacancies. This is a screen which you will use over and over again to update your actual available beds. Enter the number of vacancies you have for each vacancy type. If you have no vacancies available, please enter 0. If you have selected more than one vacancy type, you may wish to check the Flexible Vacancy box. This simply means you may be prepared to flex your vacancies across the selected bed types if a user is searching for a vacancy but hasn't specifically searched for a vacancy type where you have vacancies. Press Save. Your organisation is now correctly set up and you'll be asked to update your business continuity and vacancy information routinely by your primary health network. To log off from Capacity Tracker, just click on your email in the top right-hand corner of the page.
Okay, I hope you all enjoyed. Whoops. Okay, so I hope you all enjoyed that video. I find it quite informative. One of the things I want to stress to you is that the initial setup, I set up a bogus nursing home today. It took me half an hour. And then anything after that, all the PHN is requesting is 2 minutes of your time once a week, just to update the 2 main centres, which is the business continuity section, as well as the setup section, the edit vacancy section. If there are no changes, you just press save. If there's a change, it's a drop down and you just change a number. That's how easy Capacity Tracker is once it's set up. The other thing is what I've done for you is, unfortunately, at the moment, I can't go live with the Capacity Tracker. I would have loved to have done that this evening. However, there's an upgrade currently happening with it, and that will be ready to go on Monday. So as soon as the Capacity Tracker upgrade is done, I can then log it and run it live, and we'll be able to show anyone who would like a personal display on actually how it is done live, or I can do another show like we are doing tonight. So once you log into Capacity Tracker, this is the page that you're going to get faced with. And the video didn't go through some other things that I find really valuable for Capacity Tracker. So the page that they went onto, the tile that they clicked onto tonight, was the red one with the red heart that says the residential aged care. The next one that it can click onto is reports, then resources, contact directory, and Facebook. So the reports is fantastic for your managers because it can give a current flow to you of actually what your vacancies have been over the period of time. And I'll show you another slide for reports. With resources, I love this tile. This tile enables your workers at the residential aged care to be able to click onto, and it would go directly to a link. So what I'm just going to click over and show you So these are the links that can go directly onto your resource page. So the cDNA, anything that we think is really important that you guys have, we can put a link there directly on the page. The other one that I absolutely think should be mandated is the first 24 hours managing COVID-19 in a residential aged care facility. Again, we can put in the resource page a link that your staff just click onto that, and it goes to the latest updated link of this information that is really, really important. Now, obviously, we will have a COVID-19 page link set up and then resources set under that. Then anything that we are willing to listen to the RACFs and see what they think is important, we can add as direct links as well. They can be anything that is related to your aged care facility, but again, we would have separate headings so that your RACF would know, your staff at your RACF would know, click on the resource tile, and then they would go in and then they'd have separate headings such as COVID-19. They would click on the COVID-19 and then there'd be a drop down of all the important links that they may need to quickly obtain if so be. When you go into reports, this is the report that I love. As you can tell, I love Capacity Tracker. So I live in Bathurst, so I put in the 2795 postcode. Up comes the map. It lists, in Bathurst currently we have 5 residential aged care facilities. It lists every one of those facilities. We also have 8 GP services, and because my screenshot can't list the whole 8, but you'll get the idea, it follows down. What I again love with this, it doesn't matter who I am, I can, within the RACFs, within the Capacity Tracker system, if I clicked on Catholic Healthcare Macquarie Care Centre, over on the bottom side of the screen under the map, it would drop down the details of who the manager is, their contact number, their phone number, and their hours. Now, I can give reassurance that no vacancy information is given out to any other person who accesses the Capacity Tracker. The only people who currently see that information is actually myself and Tabitha. We are very protective of your privacy, and we know that the vacancies is something that needs to be kept private. However, any information on this screen of directory of contacts is anything someone could Google and get the information of or ring up and get the information of who your manager is and what the contact and your hours of service are. On the map, the houses are the residential aged care facilities, and the little people are your GPs. Now, again, if you click on the live system, when you click on Busby Medical Centre, it will drop down, again, giving their contact number and hours of opening. I just think this is a very useful tool because it no matter if I type in 2800, which is the postcode of Orange, it then will highlight Orange. Oberon, any of the postcodes that you want to put in there, it will lead you directly onto the map, and you can zoom in, which I really like, so you get a better image, and you can change it over to satellite if you're a person who likes to see it actually as it is. But I really like this. Comes under, if we go back, this comes under the tile of reports, and you're able to drill down right into your reports of where it is. Also, managers will have more access, which I will and Tabitha will explain when we go into the facilities, of other reports that you'll be able to generate. So therefore, you've seen a video on the residential aged care, you've seen what reports can do for general people, staff working within the RACFs, you've seen how good the resource centre can be. You can have absolutely any resource put on there that your staff have at their fingertips. They don't have to Google and waste time trying to find. The contact directory is another one which I think is a fantastic tool. Community pharmacies can be put in here. Allied health can be put in here, so dietitians, speech, physio, OT, anyone that you want to have a quick access for your staff to register who are close nearby to you. The other thing is then we've got to follow us on Facebook, which clicks the staff directly to Western PHN Facebook page. So if there's anything that you need from Western PHN, it comes up there. Now, one of the things I really would like to stress about this is with the PPE, currently our PHN doesn't supply masks to the RACFs. One of the things, by filling in your information on the residential aged care facility as shown in the video, if your PPE was to get down to red, where it's emergency, an email is automatically sent off to the Western PHN. We get an alert that your PPE you have either close to or running out of. One of our staff will then contact your RACFs straight away, clarify with you what is the situation with your PPE and whether you have any to continue or what is the story behind the emergency of it. And the Western PHN will be able to supply 2 weeks' worth of PPE or 1 week's worth, depending on what the crisis is, but we are there to help. Yes, we do not supply the RACFs with everyday PPE, but we would be notified that there was an emergency. We would be able to contact you and then we would be able to help solve the solution. This is one of the examples where Capacity Tracker will be fantastic. It tells the truth, it's live, and we would be able to respond to that crisis situation. Okay, going through this. Okay, so a summary. Looking at Capacity Tracker, we are able as a PHN to have a look at your PPE resources, your vacancies in case of an emergency such as a flood or a bushfire and we need to vacate another RACF facility near you. COVID-19, topical hot interest at the moment because COVID-19 is here and is here to stay. So as soon as, God forbid, and I hope it never happens, one of our RACFs in our area does get a COVID positive, we would know straight away and be able to help and mobilise any way that the PHN is able to help you, as well as your workforce. If you have a workforce member go down or something hits your workforce, then again, the PHN at Western New South Wales will be notified straight away with your weekly updates. And we would, if you do an update, say an emergency happens and we get an update straight away, the emergency email is sent and it is highlighted straight away on our end. So even though we ask for, on this slide it says daily, that is because that's for when an emergency is happening, but PHN will be only asking our users to use it on a weekly basis. But if there is an emergency, just so you're reassured, an emergency email is sent straight through and we would be notified straight away. Okay. An uptake of taking Capacity Tracker is voluntary for our RACFs. There is no charge, it's free. The Western PHN is covering the charge of this. Capacity Tracker will be most effective if all the primary health providers take part of this. The more involved, the better story we get. Capacity Tracker is not intended to replace or replicate current systems such as My Aged Care. We don't want to be a My Aged Care system. We are purely here to see what benefit, how we can help you. Capacity is online. It is a cloud-based, so it works on any computer system or phone system. Anything with the internet is how it works. It is a great resource tool providing up-to-date, real information and it all to the PHN, but it also provides useful links to the RACFs and GPs as who is their GPs in their area as well as who are the RACFs in their area. It's going to work vice versa. I can't stress enough that all information obtained from Capacity Tracker is encrypted and all the information that is backed up is stored here in Australia. Nothing goes offshore. Western New South Wales PHN manages the information obtained. We are the ones who manage it. No one else is looking at it. And Capacity, we store the information in accordance to the Privacy Act. So I can sit here and safely say to you that no one will know the vacancies of the RACFs except the PHN. We are not going to be discussing the vacancies with anyone. It is just there for us in case there is an emergency that we can step in and help you. And it also gives us a better understanding how your RACFs actually work. In summary, Western New South Wales PHN looks forward to working with your RACF individually. This is the beauty of Capacity Tracker. It is an individual program that is at your site communicating with your Western PHN. And to help you register with Capacity Tracker, there is myself and Tabitha, and we are willing to come out to each of the RACFs individually, sit down and set this up. This is how confident I am with the RACF. And setting up the Capacity Tracker. How Western New South Wales PHN has done it is we have already preloaded the information into the PHN Capacity Tracker so that it is all dropped down. So when you log on, as the video showed you, if you press a drop down button, your RACF is already there, and then we go from there, filling in and registering emails and users who you would like. We recommend a minimum of 2 people per residential aged care. We actually suggest that as a minimum, and the more staff who use it, the better, but it will only be the 2 managers who will have upper control and reports who will be able to access. Remember that Western New South Wales PHN is here to help you improve the efficiency and effectiveness of the primary healthcare system in your local area. I can't stress enough that Capacity Tracker allows individual focused support for your service from your Western New South Wales PHN. So I'd like to thank you, and a take-home message is help us to help you to make primary healthcare great in Western New South Wales. So I'm here to take any questions. I hope I've shone a bit of light and not confused you too much tonight. I am here to help you in any way and answer any questions about Capacity Tracker. And if I'm unable to help you tonight, then I'm more than willing to take your phone call and I will call you back. So go ahead, if there's any questions, please don't hesitate to ask. Hello. Remember to unmute if you want to ask a question. Okay, so I'll fill in this time. One of the other things that I find is going to be fantastic is the next download to happen in January will come with immunisation. So with that will come the pharmacies. We will know which, currently I'm working on all the community pharmacies doing a check on who is able to immunise, who is willing to immunise if they were requested in aged care facilities in residential places. The response has been positively overwhelming. Your community pharmacists are more than willing, majority, over 90%, to come and help immunise if need be. We have over 90% of our pharmacists currently trained with a certificate in immunisation. So all of this information will actually be available to you on Capacity Tracker of what pharmacies are able to immunise, who are willing to help, as well as what community pharmacies have stock in hand. And this isn't just with the COVID-19, because this is actually with the flu vax, and who is able to give it in their store. Has anyone thought of a question yet that they'd like to ask me? No. Okay. Tab, have you got anything that you would like to offer or share with tonight's meeting?
Look, I'd just like to thank you, and look, I think it's important to let you guys know the challenges we've had around COVID-19 from a PHN perspective. Something as simple as PPE distribution. We've distributed something like over 80,000 masks across the region to general practice, pharmacy and allied health. And I know you guys, we don't deliver masks to you per se, but to the actual rest of primary healthcare we do. So Capacity Tracker for us is a one-stop shop for them to just hit on a button and say, we need masks. So the amount of work and efficiency that this takes out of the system for us is absolutely incredible. And look, COVID's not gone. Like, it's nice to think that we have no cases, but we've all seen little waves and little cases crop up, and we don't know when there'll be a time that we might need to rely on this information. But the reality is, for us at the moment, if we have a practice or a facility contact us and say that they have a case or they've got cases, as it sits right now, we didn't have access to who were the GPs caring for those patients, what was their telehealth addresses, what was the pharmacy delivering medications to that facility. So to be able to wrap around and actually help you continue to care for your patients in the way that you do in light of COVID and a different pandemic, any other emergency, we need to know who those people are that we need to be contacting, that we need to be engaging, that we need to be looking after, so that they can keep looking after your residents. So really, this is just a tool that will help us be so much more responsive should something happen, as well as, assist you provide that continuity of care, which is what I guess we found ourselves a bit at a loss, I suppose, that this information just wasn't available at our fingertips. And when we saw this product, we actually saw the opportunity to start to create health networks within our region. So whilst we're focusing on residential aged care facilities first, because we feel like that's our highest risk populations, we want to bring on GPs, we want to bring on pharmacy and look towards allied health and maybe even specialists, so that we can actually start to build real communities, like live communities, that are connected together, that care for patients, so that we can actually be more effective should we need to be mobilising and supporting. So I'd just like to thank you, and I'd just like to encourage everyone. We're going to send out some information. Get on, have a play. You don't need us to hold your hand. You can absolutely get on and update your facilities details without us. But coming into the new year, we will absolutely be making contact with every RAC, every general practice through our teams and offering assistance to get this set up, because the more people that are on it, the better this tool becomes, the better visibility we start to have, and we haven't had that before. So I think, yeah, it's great, it's exciting, and it does help us to help you.
Yeah, and one thing, Tab, that was brought up at the other meeting that I just want to share, I forgot to say it, is a lot of people are just focused on residential aged care, which is fantastic. But when looking at residential aged care, as I've told you previously, my background is a pharmacist. What happens if your GP or your community pharmacy who services your GP, who services your RAF, who does all your Webster packing, are the ones who get COVID and they close? What happens then to the RAF? And this capacity tracker for me is, as Tab has just pointed out, it sums it all up and puts it into a nice, really easy to use bundle, so we can see other pharmacies who are close by to that RAF who will be able to step in and step up and be able to do the Webster, and while that your RAF who is at your community pharmacy is out because they've been hit with COVID because one of their staff members has been down to Sydney or Melbourne or to Queensland. Like, it can happen to any of us. It can happen to anyone in the chain of care. It's not just the staff within a residential aged care or a person who comes to visit the residential aged care. It could be someone who goes to your GP. It could be someone who infects someone at your community pharmacy. It's bigger than just the infection within your aged care. And I think that Capacity Tracker actually will definitely help solve that problem. And I'm aware of the problems that happened in Melbourne, and one of those were when the pharmacies went down getting medications in and out of the residential aged care. So it's not just looking at one particular point of primary health care. We're looking at all the factors that help our primary health care to be great. And I live in the Central West. I want our primary health care to be great. I want people to look at us and go, we are the gold standard. I want to be like them. So thank you for tonight, and thank you for listening.
Victoria, it's Susan Gardner. Have I got time for a question?
Yeah, of course.
I just wondered, I think you said that it was the capacity tracker was going to be upgraded.
Yes, there's
So-
a local upgrade that's happening on Monday.
Right, so if we were to enter information now, will that automatically go into the upgraded version?
Yes, the upgrade isn't affecting what you're doing. The upgrade is affecting what Tabitha and I are doing.
Oh, okay. Thank you very much.
Yeah, and that's just why I can't go live tonight, because it's upgrading my things. How do I explain it? It's upgrading what Tab and I can show you guys. So our password and our access is not accessible until Monday. So that's why I can't go in. And then I didn't want to use any nursing home or residential aged care to go in, because your details are then made public.
Okay,
Does that make sense? Do you understand that? Sorry,
yes.
So they're doing a major upgrade for all PHNs in January. So the one up in the Hunter Valley will be upgraded as well as ours, because we're both live. Whereas we're just doing a one for Western PHN that is happening at the moment, and will be ready for us for me and Tab to access things more so on Monday. But if you wanted to access and play on it now, go by. It's not going to affect the upgrade at all. And my take-home message is to everyone: you can't break Capacity Tracker. If you put in something as an error, you just go in and edit it. There is nothing that you can break or go, oh my God, I've corrupted the system, or oh no, there's no. Trust me, I've tried. You can't break it.
Thanks, Victoria.
And the more you play with it, the better you have an understanding of it. Anyone else got any questions? Thanks, Susie, for your question, because I'm sure there's others.
Victoria, would you mind just advancing the slides there?
Oh, sorry, darling.
Right.
Okay. I'd like to say again, thank you for attending. If you can please scan the QR image on your smart device, or there'll be an email link to follow up with an email, and just answer the questions on feedback would be truly appreciated. But as I said before, if anyone has any questions, please do not, and you may not want to ask them in today's forum, please either email me or phone me. I have no hesitation, and I'm willing to help any way I can, because I really do believe in this system. I think if no one else has got any questions, that could be it for tonight. So once again, thank you for joining us this evening. I really appreciate it. I know it's a lot to ask after work, and it's not something people want to do when they get home from work. But I also know that some people's days are so busy that they don't have time to tune into a midday one, and this is the only time they get. So I appreciate that as well. So thank you, and I look forward to hearing from some of you very soon, and I look forward to this rolling out. Bye.
Thanks, Victoria.
Thank you. Thanks, Victoria. Bye.